Dr. Tom Huebner here at Natural Transplants, and we have our patient for today. This is Alicia. Hi, Alicia.
Hi.
So Alicia has traction alopecia, and she has decided to kind of pay it forward, the videos that she's seen that helped her decide to come do the transplant today. And so Alicia, tell us a little bit about your hair loss, when you first started noticing it, how it has progressed over time.
I first started noticing it when I was about 19. I joined the military and I had to wear caps on my hair, on my head, and pull your hair back in a neat bun. And I started noticing that my edges were thinning, but didn't pay any real attention to it until about 3 years or so later, and it's like progressed. I could visibly see that it was thin in areas, and I had to swoop it or do anything. I went to a dermatologist, and he said that it wasn't, he didn't do a biopsy, but he said he didn't think it was bad or anything. The follicles were dead, so he gave me Rogaine to use. Didn't help, didn't do anything, forgot about it. Continue on trying to cover it now, had to wear wigs and weaves, and it just progressed worse until about last year. I went to a dermatologist, had a biopsy done, follicles were indeed dead and some were inflamed, so they suggested the cortisone shots. Did that for about 6 months, painful, no real hair growth, so I started researching transplants because it was in the back of my mind, but I only saw white male pattern baldness, so that's not who I am, so I needed to find someone who looked like me.
Right.
So I looked on Real Self actually, and it was a white male who recommended Dr. Huebner, your brother, actually. But when I searched his name, due to the thorough review that he gave of the facility and everything, I was like, okay, I want to go with this guy. I did a search and I found Tanya's video. I was like, okay, this is good. And then later on I saw Monique's, and she's natural, and so am I. And I was like, okay, hands down, this is the place that I'm going to.
Yes. So, and we get that all the time, and it's actually very few people that decide to pay it forward and do a video like this. Certainly, many of our patients are African American females with the same pattern of hair loss that you have. So in our hands, we know we can do a good job for you, just like we did for Tanya and Monique, and we're really excited about that today. So what are your goals for today?
A nice full hairline, no more swoops.
Right.
Ever.
So we're gonna
we're
gonna recreate your edges and then fill it in dents behind that as far back as we can get with our strip today. So, and the last question, and you already kind of touched on it. You found us on Real Self.
Yes.
And we're also very visible on other social media platforms like Twitter and YouTube and those sorts of things. And that's certainly how a lot of people find us. So, again, Alicia, thanks so much for helping other people in your same situation out by sharing your journey with them today. And we'll be checking in on you a little bit later.
Okay.
Okay, Dr. Tom Huebner here, back with Alicia, our VIP patient of the day. And so at this point in the day, we have drawn out and discussed her new edges and our plan for the day and our plan of attack. We took the donor strip, we've sewn her back up, and now you can see she's very uncomfortable and just in a ton of pain. How's the day been for you so far, Alicia?
It's been really great. Everything has been going smoothly. Everyone is nice and friendly and accommodating. Not initially with the local anesthesia, it's kind of like a bee sting, so to say, but like that multiple times, but it numbs pretty quickly. And you
maybe 10, 15 minutes of a little bit of, not even.
I think it was about 2 to 5 minutes.
And you handled it so nicely, and most of our patients do. It's a little uncomfortable, but well worth it for the rest of the day. Did you feel anything throughout the rest of it?
No.
No, we were talking the whole time, and I've been learning a lot from you about what my diet should be. That's great. So so the next step's going to be getting you back in the room, and we're gonna make sure your anesthesia is still good, and then we're gonna make the sites for the grafts. And then after that's done, and while the techs are placing, we'll check in on you afterwards. And we'll see your new edges and kind of get an idea of what your new hair is going to look like. So, any words of wisdom at this point for anyone out there that's in the same situation as you?
Please do it. It's really easy process. It's no discomfort at all. You'll be so glad you did it. It's totally worth it.
All right. Well, I'll let you get back to eating your lunch and having a horrible day. But we'll check in on you in a little bit.
Okay. Thanks.
Dr. Tom Huebner here, back with Alicia, our VIP patient of the day. At this point in the day, we finished the entire procedure. It's right around 4:30, so I think it was about a 6 or 7 hour day for her. Sitting in the chair, which I know she wasn't thrilled about, but she did an excellent job. We were able to cover the entire area of her traction, which is incredible. And so Alicia, just tell everyone how your day was and kind of how the experience overall was for you.
It was extremely well. Like I said before, only the injections for the anesthesia hurt a bit, but that was about it. And as far as them cutting in the donor site, I didn't feel anything at all. Everything was fine. The stitch looks wonderful. And the placement of the grafts, well, the cutting first and then the placement, everything went well.
Great.
Watched a few Netflix documentaries, ate some food, great conversations
Had fun with
the
our team, yeah.
Everything
Awesome.
was good.
We had an outstanding day. We're happy to do that for you. And we're going to kind of show everyone how dense we're able to pack it in for you in the area we're able to cover. So I'll just turn you a little bit here, and Charles will help us there. That's great. So you can see just jam-packed from that recreated frontal hairline with a nice curvature down into her temples, all the way back to where her good hair is. Taking as much as we could on the sides to just make sure she got as much hair as possible. So that's what you can expect with a traction case in natural transplants. Every time this is what we do, and our patients have the same exact experience Alicia has, where they come in and maybe a little bit nervous about the day, but as soon as we start talking about what we're going to do, it always turns out to be an easier day than everyone expects. So she's having a little bit of pain in her suture line. She's been laying on it for a little bit. She's taken the tramadol that we called in the night before for her, and she's going to have some prescriptions for some stronger medicines if she needs it. We're going to go over the post-op instructions, and thanks again, Alicia. I know a lot of people out there are going to benefit from your sharing your journey and your story with them, and we look forward to following up with your progress.
Call us now, 844-327-4247, and ask about our Hue and Hue Plus procedures, which move more hair than ever before. Hope to hear from you soon.